Peptide conversations are no longer limited to elite athletes, anti-aging clinics, or online biohacking circles. They are now showing up in gyms, recovery centers, med spas, functional medicine practices, dermatologists, and wellness businesses of every kind. That expansion creates real opportunity. It also creates a serious risk if people, whether consumers, providers, or business owners, move faster than their understanding of what they're actually getting into. Jesse, in part one of our peptide series here, we focused on what peptides are, where the narrative has gone wrong, and why responsible evaluation matters. Today, we want to focus on what is actually happening out there. So let's start out with where are you seeing peptide interest grow fastest right now? And what do you think is driving that?
I would pinpoint it still down to the more of the wellness, the wellness spas and clinics. I think that's still one of the major hitters, and I think one because I think they're the biggest component out there marketing this. I think they're the biggest drivers to peptides than most others. Yeah, the gym bros, the gyms like it, but they're only on certain type of peptides, and it's the muscle building peptides. While like these wellness centers, they're kind of they're kind of doing everything. They're hitting all the categories. And I think in the one, they're promoting it, they're pushing it, they're marketing it, and no one else really is. Doctors aren't. You might get some doctors on podcasts. You might get them on, the Instagram and Facebook. But other than that, they're not pushing out that many ads unless you're one of the big, conglomerates out there that are pushing the weight management ones.
So you mentioned a couple of things there, three things, three segments. And today we are going to look at this from the perspective of three different audiences. Consumers who are already using peptides or seriously considering them, the medical providers you mentioned, and med spas that are evaluating how to offer them responsibly, and fitness and wellness businesses whose clients are asking about them, but who are not medical practices and need to understand what that means. Each of those audiences has a different question. Jesse is in position to speak to all three. So joining us again is Jesse Nicassio, former NFL player, head of the peptide program at Pro Players, and founder of Juke Performance. Jesse sits at a unique intersection of this market. He manages provider relationships and pharmacy access through Blue Atlas Biologics, and that's a wholesale portal connecting verified clinics and med spas directly to licensed 503A and 503B compounding pharmacies. He understands the gym and consumer environments through his own facilities, and he has helped structure the Peptide Prescriber Academy and Hive RX. The latter is a telehealth model that creates a doctor-led access pathway for consumers. That combination of pharmacy infrastructure, consumer-facing experience, and fitness business perspectives makes him a strong voice for this conversation. So Jesse, so I say, as you mentioned, you are seeing this from multiple angles simultaneously, consumers, providers, and wellness businesses. Before we get into each audit separately, what does that overall picture tell you right now about where this market is heading?
Vertical, going north, going up. It is heading in the right direction for the ones that are really on board with the market.
All right, great. So we're going to go vertical. I'll go up here, and you're doing that. And I want to remind you because you're watching Well Wave now, and that's where timeless wisdom lights your wellness path.
Yeah, welcome back to the program, Jesse. It's great to have you on. Part one was excellent, so we're looking forward to this part. In part one, we talked about the confusion, some misconceptions, misinformation out there about peptides and what responsible, evaluation looks like. We spent some time on the quality. We spent some time talking about sourcing of peptides and why physician oversight matters. Now, we want to look at the people driving the conversation. Consumers are now asking about peptides it's not in a vacuum anymore. They're asking because they, are trying to solve problems. They already have, a deep, a deeper understanding, and the range of the problems has grown well beyond what most people expect. So Jesse, in your conversations with consumers, what specific problems are people most often trying to solve for when they're, first asking about peptides? And is that mix of problems different today than it was maybe even a couple of years ago?
Now, I say the biggest one is still the weight management, the whole weight loss. That is the number one. And it's so funny. I mean, being in the health and fitness game for as long as I have, from 20, 30 plus years ago till now, everybody's still looking for that magic pill. It's the magic pill, which I still say to them this day, there's no such thing as a magic pill. Peptides are amazing. It's not a magic pill. All right. You have to do your due diligence. You still have to go out there and work out. You can't poke yourself, sit on the couch, eat Doritos, and then think you're going to lose weight. All right. You might not be hungry. You know, I might waste away, but it's just that's where it started. That's where it's at. And it's so funny. It's just now moved on to a new supplement.
When you say a new supplement, are you saying peptides is viewed as a new supplement by the public? Okay.
Yeah,
Yeah.
it is definitely the new supplement. 1990s, the late 90s, when it came to sports and fitness. The supplement back then was creatine. Everybody and their mother wanted to be on creatine. Had so many misconceptions of creatine. It was going out every which way. And now to this day, they've done so much research. They've done so much marketing. Now we know how well creatine works. And peptides are the new creatine of today, which is also a peptide.
Dr. Bob, from your research background, working with clients, what does it tell you when people are seeking tools, beyond the weight loss, but for peptides for recovery, pain, energy, metabolic health, rather than just waiting until those become clinical crisis, how people are trying to manage their health today?
Well, I think Jesse hit the nail on the head when he said that it's peptides are another supplement. People are always looking for what supplement can I take that's going to solve my issue. And what Jesse said is really important. Everybody has to do their part in this. It's like a team effort. You've got the peptide, you've got the prescriber or the coach, and you've got the person who's taking it. And if the person who's taking it's not doing what they need to do, it's an issue. And I think it's a kind of like a positive sign that people are looking for. They're not waiting for the crisis to come. That's good. So they're using some of these things like peptides and other supplements as kind of like preventative. Let's prevent the onset of the issue. But then you run into the other side of the coin where, people have to, really check in with themselves. What's their mind, brain, body connection telling them about when they take something like a peptide, and are they doing the work, and how do they feel while they're doing it? People need to really monitor themselves, get in touch. A lot of people are numb to themselves, and they really need to be in touch with themselves so they can provide feedback to someone like Jesse or physician or coach on what's going on with this. Is it working? Is it helping? How do I feel on it? Are there any side effects? People really need to monitor if they're experiencing side effects. If they're not, that's great. If they are, they need to make some adjustments and talk to people who know how to do that.
Yeah. And if those side effects are outweighing the benefits, right?
Yeah, that's your
All right.
We're getting into Brett's tagline there again, that just scary drug facts tagline.
Yeah.
But Dr. Bob, we had a conversation here recently with one of our wellness heroes, right? Dr. Jerika Dodd, and she had that comment about be the CEO of your own health. That's what came to mind. Is that what you're seeing out there? People really are stepping up to that responsibility more.
I think there's a couple of camps out there. Maybe Jesse could comment on this, but I think one camp is people who want to looking for the supplement and they're not going to make any changes and they're not going to seek advice. They're just going to take it because they think it's the right thing to do for them and they're not going to make any changes. That's not the CEO of their health, right? However, there are other people who are starting to look at themselves and saying, I need to take care of myself. Maybe I'm not getting what I need from the medical care that's out there or the health care that's out there. So I need to become the CEO of my health. And what I was saying before about getting in touch with how people feel is really important. Like, what's the effect? We can't go through life being numb to what's going on around us. We need to feel what's going on with ourselves. And when we start taking peptides or other supplements. And so I think it's really good that the people are looking for answers. And if they were willing to become the CEO of their life, perfect. That's the formula, and then they can monitor themselves, and instead of like sitting on a couch, like you said, Jesse, and eating all the snacks,
Eating Doritos. Yeah.
gotta do the work. Yeah.
So I do have a question for you, Jesse, when it comes to, an active but aging adult. What is different from, a young performer? Are they asking the same questions about peptides or are the questions different, whether they're, actively aging adult or if they're a young performer?
It starts off the same. They start off always, how can I take a peptide to improve muscle mass? So it always starts off relatively the same, except for maybe the younger demographic is not worrying too much about the weight loss side of things. I would say that's more, but They always start off that way, but then it tailors and it goes a totally different direction because then they realize that they're not young, that their body has changed. And now they're asking more about, okay, how can I kickstart my mitochondrial? How can I do something a little bit different to get to the level where my muscle mass can start rebuilding? Because as a younger kid, we already know their testosterone levels are probably higher. And so then we really got to ask when it comes to the adult side of things, like, have you got your blood work done? Where are your T levels at? The big thing is really, what are you eating? Young kids, younger adults, whatever, they can eat a whole lot differently and a lot more crap than adults and get away with from it. All right, get away with it. So, it starts the same. How can I feel better? How can I put on more mass? But then it starts going to a totally different direction depending on who they are, what they do, and obviously the current status of their life. The young adult, if they're in their 20s, might not have kids. They don't have a wife. They don't have the stress of the business after all those years. Big difference. Because then I start going into, if this young adult was never an athlete and this adult was an athlete, we know that he has a lot of wear and tear on his body. All right. We have to start him off in a little bit different way. We know that his stress level with being married, having kids, it's at his peak. Look at his hair color. Look at everything. You're like, he's he's just he's at a different position in his life. So he will start off with a different peptide than most.
Yeah.
Well,
So
that
as you start them off, people in those categories, what are the 2 or 3 things that they should do in helping them judge whether the peptides are working for them or whether the peptides are really even appropriate for them, Jesse?
I mean, I guess I've always the outcome. If they give it a true test and they stop drinking, all right, because here's a huge part of it too, is I was on the phone last week with somebody and he's taking GHKC, I think a couple other different peptides. I go, do you notice a difference? He's like, I don't know. I go, are you still partying? It's like, yeah. I'm like, how much? He's like, I'm still
What?
drinking every night. And I'm like, dude, come on, yourself a chance. He's like, I know. I gotta give him. I'm like, I'm not saying cut drinking. I'm not saying that one bit. Have your drinks on Friday, Saturday night, but you cannot be drinking a bottle Monday through Sunday and expect something, I mean, if you want to do it right, yeah, you stop drinking altogether. But I'm just saying, if you got to have your drink every single night, that's like, you can't have a pizza every night. You can't have, you can have maybe your glass of wine, but it wasn't just a glass of wine. And, that's truth player.
This is such a great conversation, Jesse, because you're really promoting holistic balance, and that's so, if people could listen to you speak, listen to all of us talk about this on the show, holistic balance is where it's at. I mean, nobody's going to get better if they're just living the same exact lifestyle that got them to where they are now. They can't pop anything and hope it's going to work. So that's a beautiful way to talk about it, Jesse. Thank you, really.
I
Yeah. So you look at how it works, you look at how you're performing. Do you encourage people as they start taking peptides to have their blood work checked to see if things are changing in any aspects?
Absolutely. I get my blood work done every 3 months. So I'm looking at everything. I just got my results back. Was talking to my doctor last week. Everything checks out great. But yeah, I encourage everybody, figure out what's going on, because you know what? There might be a couple biomarkers that are off that's triggering another a side effect that you may not realize, and that your first thought was, let's put another supplement in my body. No, 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 no. Like, no, don't start adding to it. Figure out what you're missing. That might be the whole thing that might be creating anxiety or whatever it may be. And if you're doing great, then yes, look into peptides. But blood work is definitely essential.
Okay. So if someone doesn't have a local specialist or a provider that's really knowledgeable in this topic yet, so what does that responsible first step look like? Does if you use that, we've mentioned Hive, which is a physician led model, for example. Kind of walk us through what happens before someone receives a recommendation and what information should be gathered, and what makes that What makes that process, a good process from other things online, from simply ordering online for something?
So are you talking like more about kind of starting the process out? I mean, looking for your local doctor, looking for your local, yeah. I mean, that is the biggest thing. Try to find somebody nearby, set up an appointment, do the consultation, have a free flow.
What if
You want to add to that, Bob?
what if somebody's going to a wellness center and
Well,
saying, "Hey, I
yep.
mean, do they have the personnel to advise, generally
Yes.
speaking?"
Yeah,
They
so
do?
absolutely. A lot of the wellness centers, so the doctors, the MDs, anybody's working at these wellness centers, a lot of them are contracted and they work for many other spots or they do a telehealth on their side. So even if you went in there, even if it's a all women's wellness center or all men's, walk in there and you say, "Hey, I would love to talk to somebody." And a lot of the all women's one will literally, they're opening up their doors now to bringing in men because the doctors themselves, they know both sides. And you got to capitalize on the opportunity. Don't be shoving away the guys and tell all the girls, but you come in there, get to know the doctor. Once you do that, the doctors is ask you a bunch of questions. Hopefully they're crazy knowledgeable and they're asking you the right questions. And
Okay.
then from there, my doctors always said the next step was, do you want to get your blood work done? Like, let's kind of take a look at this. Let's see where you're at. It could, for male and female, there could be a testosterone issue. The female could be like, I'm not sleeping at night. I wake up every night at 3 a.m. It could be a cortisol issue. That's going to show up in your blood test. And they might be thinking they're waking up at 3 a.m. having these crazy running thoughts. And they're like, oh my gosh, I'm just stressed. I'm so anxiety. And literally, maybe their cortisol levels were out of control because that's when they start to peak. And maybe it was just a very easy fix. So you do the blood test. So doctor, blood test. And then after that, you weigh out your options if it's peptides or other type of supplements on the market.
Okay. And then you've got this hive model, right? That people can utilize or can be utilized.
Yes.
Why did pro players decide to come up with that? And then how does that process look? And does that match up and how you just said things can be done and should be done?
Yeah, absolutely. So the pro players, when we brought out both of these type of platforms, we wanted one for the medical specialists out there, one for the medical specialist to get on our platform, have a very easy ordering process. So that's our Blue Atlas platform. They love it. That one's great. We built it exactly what it's intended for, and it's working. Then we're like, well, what about all the other consumers out there? The ones that cannot get to these doctors, cannot get to the peptides. We're like, well, let's create the telehealth platform. So that's the Hive RX. And that one is where it's kind of a twofold. If you have no clue about peptides whatsoever, you can actually go on there and talk to the AI physician. You ask this AI physician all the questions you need to know. And it's just going to tell you. After you're done, you create a consultation with a real physician. And you're like, hey, I talked to the AI physician. It's telling me I need to be on BPC. And the regular physician says, yeah, okay, why? What's going on? And you tell them, oh, yeah, I'm banged up. I got this, and that. They're like, okay, yeah, you're right. Now, no matter where you are at in the US, our telehealth hits all 50 states. So then this is a way for the consumers to get on and to pay less. So the one thing I've noticed living in California for, a good 45 years out of my life, dealing with Beverly Hills, dealing with LA, they price gouge you. All right. A lot of people do not have starting off to do a weight management $600 a month. They just don't have it. And so then we created a way where it's going to cost you $150 a month. And so we're making it affordable. We're making it accessible to everybody in all 50 states and a way for everybody to educate themselves, get on this platform and start using peptide. So that's why we created both platforms for both B2B and B2C.
Great. So that's a good way of approaching the market. And as we know, we've kind of alluded or talked to a little bit in this market. It is, yeah, about weight loss, but as you talk about the use for yourself, it's about, your energy and your performance. So, that demand out there includes all those things, the weight management, the recover better, move better, live more effectively, maintain that energy as one age. So, we'll move into, now how medical providers, med spas, and clinics, we incorporate that a little bit, but how they're actually responding to that demand and what separates the ones doing it well from the ones who aren't, we'll go into next. But before that, we want to hear from Breck Rice a little bit.
All right. Thanks, Tim. So, if you're looking for practical ways to support your health beyond today's conversation, take a look at some of the solutions we personally use and recommend. Brain IQ Pain Eraser Roll On is used by our very own Tim Daniels after years of knee damage as a D1 athlete and an avid exerciser. He gets relief with Brain IQ Pain Eraser. It delivers instant, targeted relief using advanced nanotechnology combined with powerful natural ingredients that absorb quickly right where you need them. No pills, no mess, just roll it on and get back to moving. It's ideal for your lower back pain, knee pain, shoulder pain, joint discomfort, or everyday aches and pains. Makes a great option for active adults, busy professionals, or anyone just tired of pain slowing them down. Try it for yourself and experience fast, targeted relief with Brain IQ Pain Eraser Roll On. We'll leave a link in the show notes. So, as we look at the medical providers that Tim mentioned and med spas and the clinics, peptides aren't just a trend anymore. They're becoming part of the everyday conversation, and patients are expecting that conversation. They're wanting these peptides, and practices are differentiating themselves by carrying peptides. So, people are looking for that personalized care now. And so the question is not just, whether they offer them, it's how do they, how are they getting the medication? So the sourcing of it, the quality, are they clinically holding up? Are they safe? So that's what we want to get into next. So Jesse, what are what are you hearing from these medical providers and med spas and clinics about, why they are interested in adding peptide related services?
FOMO. They're afraid of missing out, and they are. They are absolutely missing out, and they know they are. Every time I get on the phone for a clinic that is not into it yet, they're just like, they're like, should I get into this? I think I need to get into this. I'm like, I think I'm missing out a lot of patients, and I tell them like, you are. You 100% are. I go, the more if you think about like, and I ask them, where are you located? And they might be in a rural area. They might not be even in a city. I go, just imagine if what it was like being in LA or Miami or Scottsdale, Arizona. I go, it's talked about so much, and those places all had to adapt to it real quick because they were missing out on tens of thousands of dollars. And so that is the big thing. They know they're missing out, and they have to bring it in. They have to capture it. They have to capture not just the same audience they have, a totally different audience. They gotta, you gotta build your pillars. And they understand this, especially med spas. Med spas have a very hard time, and they got to add on different pillars. And peptides right now is one of them. Years ago, it was IV drips. Then it was, forget one of the other ones sitting in a chair, but this is not an IV drip that you have to sit in a chair for 2 to 3 hours. It's a
Yeah.
pump for 5 seconds.
And so when you look at that, we talked about weight management quite a bit from the consumer demand and a couple other things and a few other items from the consumers, but what problems or what issues do you really see that providers focused on solving in regards to their patients for the practice?
What are some of the problems that they're focusing on the most?
Yes.
Would probably, I mean, yeah, other than weight management, I mean, weight management would be the probably number one. Just even looking at our numbers on what is ordered and what is going through, weight management is the biggest thing because obviously, as we all know, the weight management that's going to cure a lot more. Yeah, if you're having pain issues, yeah, it might be from an old injury, but you're also carrying an extra 150, 200 pounds. I'm sure if you got rid of that, your knee issue might go away just a little bit more. Probably pain and recovery, the longevity side of it, just the everyday of feeling good, waking up, getting out of bed, and just having that energy. I think between those three, the energy and feeling good and the weight management is really what these med spas, these clinics, because if you're feeling good, you're going to come back. You're feeling good, you look in the mirror, you think you're looking good. All right, it's all going to correlate, and they're going to keep their customers coming back.
Okay. And then along those lines, you've got more people looking at that, kind of coming back from med spas. The ones you're seeing that, let's say they're at a more advanced level. I think you had a conversation. I understand a week or two ago with a doctor who's talking about precision medicine and longevity. What do you see those more proficient or experienced ones, what do you see them really focused on? They've been using peptides quite a bit.
I mean, the ones that are heavily experienced, they're testing the peptides with exosomes and stem cells. I mean, those are the most experienced. I was out the other week with a doctor from the University of Florida, and they're doing how can peptides, stem cells, and peptides, exosomes come together to even have better results, faster results. So, I mean, on the most experienced levels, that's what I see on my side is kind of stacking those together. Yeah, I mean, I think that's the way it's going to go in the near future is adding all of them together for like a little program.
Multimodal.
And so are they with the stem cells, the exosome and peptide, are they then they're looking for the regeneration? Are they looking for the lengthen the telomeres? What are you hearing they're doing with all that, Jesse?
The biggest one is I think they're mostly testing it on. This is what I see. I'm sure Dr. Bob and might have a different side of it. Is more on the longevity, anti-aging, and pain reduction. That is like the biggest thing by adding those together, really cleaning out, really feeding the body with inside, which then the others will follow.
I agree. So it's just, Bob, you spent years leading integrative wellness programs and delivering integrative wellness to your clients, and then once led a major health system in that. So as we look at it from the provider standpoint, what do you think providers should be careful not to lose sight of when they add optimization or recovery offerings or the longevity offerings in a clinical environment? What does good clinical judgment look like in that space?
I think it hasn't changed with, good clinicians really need to understand that all their patients are different. That's the thing that blew my mind when I started leading an integrative medicine center. It's like first clinical trial I did was with severe migraine headaches, people with headaches for 6 to 8 hours a day. And I interviewed everyone in the clinical trial and I couldn't believe it. I said, how the heck can we use one modality to solve all these people's problems? So I think and it turns out that you can't. At least for really serious chronic conditions. I think clinicians have to realize that all their patients are different. They have different comorbidities, different concerns, different lives, different histories. So that a good clinician will take all that into account. And I'm betting, Jesse, I don't know that much about the med spa docs, but I bet they have more time to interact with the people who they're talking to than typical physician in a healthcare system, which gets 10, 12, 13 minutes with a patient, and that's it. They're in and out. You know what I mean? So you got to spend time with the people. You got to get to know them. You got to find out what's going on, and then you got to get the feedback from, how's this working for you? Like Jesse said, how you feeling? And the guy said, not much. And Jesse said, well, what are you doing? What are you doing? That's the next question. Are you making changes? Because people have to. So it's a real team situation where you've got the peptide that's going to help the patient in terms of its internal physiology. You got the clinician or the person, the coach who's going to guide them on how to use it. And then you got the patient who's got to give feedback, and it's all got to work together. If the patient's not giving feedback and the clinician's not asking for it, then it's a problem. So they got to watch out for that.
Right. And then along those lines, as you work with your clientele and your clientele starts asking you more and more about these peptides as a clinician, what's your thinking on what should be asked about sourcing?
It's all about safety, really. It's all about, so you got to look for the quality of the product. People need to investigate for themselves, what's going on. We talked about being the CEO of their lives and CEO of their health. They have to check it out. I can make recommendations. Jesse can make recommendations, but we still have to vet everything. We need to check it out. How's it going? So quality and who's providing it. And then, and also the other thing I wanted to mention is that I think that Jesse brought it up in the last segment. Slow introduction, I think, is so important. If you just slam it in there, that could be too much for the body and it could stimulate side effects. So I think slow introduction, just like slow removal, is important. So that's a real critical concept for both providers to know about and patients to know about.
And in part one, we did draw a good clear line between, pharmacy grade compounded peptide from a licensed 503A or even a 503B pharmacy, versus it coming from a research lab or something that's unregulated, an unregulated source. So for a, provider trying to build a credible program, why does that sourcing really matter as much, and how does it show up in their day-to-day running of the practice?
I mean, it's the way that it's going right now. A lot when all this started, a lot of the doctors they were using labs, but they realized there is a lot more liability on the side when you're using a lab that is not a 503A. They're not a licensed pharmacy. When you use a licensed pharmacy, you have less liability. All right, the pharmacy takes on all liability when it comes to its peptides. They're figuring this out too. Plus, if you want a long sustained business, you do it the right way. The pharmacies will be here. The labs can get shut down any second. Hey, pharmacies can go if they're not doing it right, get shut down. But the pharmacies are doing it right. They're under a lot more restrictions or regulations than labs are. And these doctors understand this, and the doctors understand that these pharmacies are sourcing the ingredients from the right places. Where the labs, they don't give a crap. They'll source it. The lowest bidder wins. And they're like our government. Lowest bidder wins, and hey, we don't care what we make. But these pharmacies, they after, and so that's why a lot of it's shifting towards the pharmacies. And you know what? The amount of education and lack of knowledge that I was on a call today, and I was on with a doctor. I'm like, what pharmacy are you using? He's like, I was using this one pharmacy. I go, okay. So he starts reading off some of these prices to me, and I'm like, oh, this sounds fishy. I go, can you say this pharmacy one more time? So I went and looked it up, did some deep dive. I go, sir, as he's on the phone, I go, that's a lab. And he goes, really? I go, that's not a pharmacy. That is a lab. Yeah, they might be a licensed lab. They are not a pharmacy. And why you're getting those prices is I bet those peptides would come from China because those are Chinese prices. And he goes, I did not know that. I'm like, so now he kind of knows. I go, listen, don't worry, doctor. You and a lot of other people are told from a lab that they're a pharmacy. They are not. So the experience and education and their understanding is starting to come out too as this gets bigger and bigger.
Yeah. So, other than the sourcing of it, what are some other, operational frictions for a provider that wants to get started in this space?
I would say state restrictions. Each state has a different restriction. So Connecticut, Ohio, Oregon, Washington. I think it was either Oregon or Washington. I'm pretty sure it was Oregon. In order to prescribe peptides, the MD, you just can't have an MD on board or a nurse practitioner or DO. They actually have to have ownership within your company, and it has to be over a certain percent. So now you're giving up ownership to some random doctor just for them to come on in, and so you can prescribe. So that is one of the restrictions. Certain peptides in certain states is a thing. So more about the rules and regulations per state is what some of these clinics are seeing.
Okay. And do you think the majority of providers, so you got the rules and regulations, you got the sourcing, are the people entering it, or they've been in it for a while, or do they really understand how to monitor it correctly and dosing and all those other things, or are those things being asked of you as well by providers?
I mean, yeah, those are being asked to me every single day, all day, all night. Yeah, that's a nonstop. I mean, if I'm dealing with a senior doc who's been in this for a long time and understands dosing, reconstituting, they don't ask me many questions. If they're relatively new or have never started, they are asking me a lot of questions. And my site, so my other company, we created a education program called Peptide Prescriber Academy. And it was literally created just for the docs, for physicians, any medical professional. It teaches them all about peptides, teaches them all about dosing, reconstituting, side effects. I mean, it goes beyond, because we realized that my consultant, he's been doing this for a lot longer than me, realized like, these medical professionals, they truly don't know what they're doing. He goes, this is going to be bad. And we're right. We don't want them to give peptides a bad name. We get it that they really are trying their best. But you know what? Why not give our knowledge, everything we know? Let's give it to them. It ain't free, but we're giving to them where they're able to get on there. And we have doctors, so many doctors now using this Peptide Prescriber Academy to jumpstart their game into the peptide world. And they're doing like a fast track. And now they're like, all right, I'm going to try the peptides on myself. They're learning reconstituting. They're learning everything. And then now they're going to adapt it to their clinic, which I don't think we had any of this back when peptides obviously was created. So that's why I got a bad name. People taking too much and puking their brains out, all of that type stuff. So
That's fantastic. It's fantastic that you're providing the physicians that ability. That's going to fast track everything, get everybody on the same page, or whoever's willing to participate. Really great move, Jesse.
Yeah, it makes it effective because as it just coming through my mind there, they're in this market. It doesn't seem, it's not like medication, right? Everybody knows, hey, a child under 16, you give X amount. Someone that weighs as much as Dr. Bob, you give that amount to.
Tim, come on, man.
Hey, hey,
I just have to show you the guns.
my stomach's probably maybe bigger than yours, but that's why, I got to have somebody to pick on to keep from picking on
Yeah,
myself.
I deserve being picked on sometimes. I'll let you go, Tim.
All right, appreciate that. But
Yeah.
and even supplementation, there's a lot of work around supplementation to say this amount of vitamin C is actually therapeutic and it's not. But I think what Jesse's articulating there is that in the peptide world, that's not as readily available for doctors and providers, and so you got to have that form to get them going properly to have good outcomes for people.
And they ask for a lot too. They truly do ask for it. I mean, they want Blue Atlas and all of us to provide it. Legally, there's things that we can and cannot do on the Blue Atlas side, but my other companies and consultants, they can do a whole lot more. But as we get asked more, I get it. They really want this, and they don't understand on how in depth it goes. It's just not a one pager, and that's what sometimes they're like, oh, do you have like a guide, like a sheet or two? I'm like, no, there's hundreds of peptides. There's so much different. There's 5 milligrams to 1,000 milligrams. That all is reconstituted. And depending on the peptide itself, you might be taking a 0.5 of something. So I'm like, it's not an easy read. You really have to indulge in it. I'm like, how'd you get your medical degree? They're like, I went to school, paid a lot of money. Well, you're going to have to go a little bit back to school and pay a little bit of money to fast track to this peptide game.
I wanted to just go back and emphasize that every human being is different. And also the other thing that people want to realize is that if they're taking supplement A and supplement B and supplement C and peptide A or peptide B and drug A and drug B and drug C, they got all that stuff on board. And that's never been studied by anybody, the combinations that can occur. So that's why, getting in touch with oneself, that was always my issue, having played college football and just beating my body up and, ignoring feelings, right? You had to be able to run full speed at somebody and go, no big deal, bam, no big deal, right? No pain, nothing. It took me, and I'm still working on it decades later, but it took me decades to start to get the feelings back. But people really need to get in touch with, if I take something, if I'm doing this, if I'm doing an activity, what's the effect on me? How am I feeling about it? Because that's the feedback that any good clinician's going to need, any coach is going to need to know how to help, the situation. And I love it when Jesse, when you say people could be taking too much and puking up, because that's the way it is. These combinations of supplements and drugs and, peptides, everything, who knows what's going on. So that's why people need to stay in touch with themselves and how they're feeling, and then provide that information back to the providers.
Right. So here's a scenario follow up on that with you, Jesse, which, I've had seen happen here recently. So a patient kind of walks in and tells the provider they've already been using this peptide. They found out about it with Reddit, talked about it with somebody at their local gym. They went online and bought it. No prescription, no oversight. What are you telling providers to do with that? And what does it say about why structure matters before that moment arrives?
I always tell them, ask that person, you went online, you purchased it. It was an easy purchase. Where did it truly come from? And the customer is like, oh, I don't know. I'm like, okay, that's one big issue that we have. You're getting something offline. You don't know where it's coming from. You don't know what other products are in it. Quite frankly, you don't know the potency of it. It could be baby powder for all you know. And, you're thinking it's, might have a placebo effect, but the provider has to talk to them exactly about why you're not going to go to the gray market or the black market to purchase something. All right. Yes, you go to Reddit and they're like, oh, I get these Chinese peptides and they work great. All right. I also was on there, and there was a package seized about 4 months ago of peptides coming in that had fentanyl in them. All right. What if
Gosh.
that one got out?
Yeah.
Now, all of you Reddit guys, Jimbos out there, all I could have been now been reading was, hey, we lost half of us. It had fentanyl in it. The thing is, you just don't know. All right. People overseas, they don't give a crap about you. All they give a crap about is the money. So do it right. You just fine. Instead of paying $20, you pay $65. Is it going to break you? No. All right. Do it right. This is your health. If you're taking this because if you really want to have optimal lifestyle, well, why are you taking crap? Take the real stuff. So they really need to understand this when it goes online and coming from a true source. They really need to talk to their patients about this.
Okay. Well, in our next segment, we really want to, this information is especially relevant to our gym owners, recovery centers, Pilates studios, yoga studios, martial arts, schools, your professional trainers and wellness businesses of every kind. you know, these businesses often have a real deep trust with their clients, which is great, but trust is not the same as having clinical authority, right? And so the decisions between, or this discussion between whether it's your opinion or if it's making a clinical, decision, that's where we want to discuss next. So, Dr. Bob, I've got a question for you. When you look at these non-medical wellness businesses, and for our listeners that are listening today, what is that boundary between education and a medical decision making, beyond legal?
Well, education obviously is just people checking out what's going on and learning about the things. When you talk about the medical side, that's where you really want to have your providers involved because there's so much unknown about the you got variations in patients, variations in history, variations in drugs and supplements and peptides. You got all these variations. So, people need guidance. So they get educated, they learn about it, but then they got to get the professionals involved on some level. They have to,
So
because if they
what can
don't, they
actually
can get into big trouble.
yeah, what can actually go wrong though, Dr. Bob, when the line gets blurred and even with the best intention?
Side effects big time, just disrupting their whole health status. I mean, that's a big problem. And the individual, none of us even can really know with all those parameters coming in. How are we going to know like which one of these things? There's like 10 variations or 10 components, 15 or 20. How are we going to know which of these combinations of things, which have never been studied anyway, in clinical trials? How are we going to know? So we need the feedback. We need the help. Every Olympic athlete's had a coach. Every human being should have a coach of some kind, to help them, guide them through this stuff. So you don't have side effects. You don't cut into your longevity thinking you're helping your longevity, right? And make yourself sleep worse and have your energy levels going down. It's a team effort. You got the stuff people are taking, you got the person who's taking all the stuff, and then you got the clinician or coach who's providing feedback, taking the information in, guiding them on how to be healthy. It's a team effort.
Yeah, so for a
Great.
gym owner or a trainer, someone like that, what, this may be a question for you, Jesse. What support would you give them on, getting into peptides and making those recommendations where they're not crossing over into prescribing medicine?
You know what? I would get the consultation type of support, helping them understand on what they can and cannot do as a gym owner. So through the legal side of it to understanding their gym members and what they should and should not be doing, giving them that support so they have a true understanding and asking them a lot of questions, about themselves, about their gym. That's one of the biggest things too, Bob, is that you said a little bit ago is about the physicians, these doctors, asking the right questions. Everyone needs to ask all the questions. What are you on? What type of medications do you want? What is you tell me the truth. I always tell me the truth. You have to. I don't care. I don't give a, I've been through with a lot of people. It does not matter to me. You just have to tell me so I truly understand what type of side effects you're having. Perfect example, last week, somebody called me up and asked me if NAD can give them anxiety or, speeding of the heart. I go, yeah, it can. I go, why? They kind of started explaining the symptoms to me. I'm like, wait, when did you take it? They're like, in the morning. When did this happen? They're like, around 10 o'clock at night. I'm like, 10 o'clock at night. I go, okay, where were we at? He goes, I was at the bar. You're at the bar drinking? He goes, yeah. He goes, oh my gosh, I totally forgot. I took Adderall. I'm like, oh, you took Adderall with NAD? He goes, yeah. I go, yes, absolutely, yes. You're going to get anxiety from it and racy heart and shortness of breath. Like, come on. Yeah, like, I'm glad he told me. He's like, oh, never mind. I'll talk to you later. like that. But the thing is, ask all the hard questions, and what you're saying. But for all the gym bros, for all the gym owners out there, I feel you. I'm also a gym owner. Yeah, pick up the phone, have a consultation, get to learn all the ins and outs, all the experiences, and figure out if this is something you want to dive into. Either bring in a medical specialist on board with you or go to HiveRx, our telehealth platform.
You
Yeah,
you
but it sounds
provide that service, right? You provide that service, Jesse, right?
yeah, and so
Okay.
along those lines, what does a doctor-led telehealth model like HiveRx actually allow that gym owner or wellness business to do that they shouldn't try to do on their own? What does that HiveRx telehealth model really enable the non-medical fitness or wellness business to do that they shouldn't be doing on their own? And just kind of
Uh,
walk through how that model works in practice for that gym owner.
so what can the HiveRx, what can it do for the gym owner, basically?
That's okay. Yeah. So if you're a gym owner, you're a chiropractor, anybody who is not a licensed physician that can prescribe anything. So if you're not an MP or an MD, you're not legally allowed to prescribe peptides or any of the supplements. The HiveRx allows you to still particularly offer peptides to your customers without doing it legally, without you actually now taking payment from them and them, pretty much you doing it the wrong way. They go through the HiveRx, they go through licensed providers, they go through our pharmacies, they do everything legally. We set up a platform and a marketing service for you, and we allow you to go on there and then now allow your customers to use peptides.
So
Whoever,
they can charge for their consultations though, right?
yeah, they can. Yeah, I mean, well, if they're doing a consultation, if they're not a licensed doctor, HiveRx charges for the consultation. The gym and everybody else, no, they're not. They're not allowed to do consultations. It's pretty
Okay.
much off their hands. They get a URL with their name with HiveRx/fitness guy. They're gonna go to that. Our side and our doctors, our professionals handles everything else from there.
So what are you seeing mistakes being made out there, Jesse, in fitness centers or wellness, businesses? What's the main mistake that you see in their structure or setup?
Them offering peptides, or I've actually seen it where they've brought peptide vials on the shelves at their gym. That was maybe the biggest mistake I have ever seen. I looked at them. I was actually there. I said, "Hey, I wouldn't do that if I were you." I'm like, that is like the quickest way to get this whole place shut down. You cannot put them on the shelves. So things like that, and it doesn't matter if they say, I didn't know. Well, nobody, the person coming on in here, they don't care if you don't know.
I think we've got one more question here for you, Jesse, before we let you depart from this episode today.
You
So,
got
Yeah, if you had to give, just one piece of advice to each of the groups that we discussed today, so a consumer who is evaluating peptides, a medical provider or a med spa building a program, and a fitness or wellness business trying to figure out, where they fit, what would you tell each one of these groups?
educate yourself with your market. Really dig down deep to who you guys truly are, who you serve, and where do you want your company to go. And that will help drive you in the right direction with the peptides, any supplement, and any type of business vertical. You got to truly know your demographic and your market. You got to truly know the education side of all of this so you don't make up. It's not when you first start something, as we all know, when you start a business in the very beginning, it's really not about making money. It's about how not to lose money. That first couple of years, you might be going out getting loans here and there. Know your business, know your market, and know your product. Then start this process. And then that part will show you the direction.
Yep. And so for our listeners, if you need help, you can reach out to Jesse. He will put his email in the show notes. For those listening to the podcast, it's Jesse at proplayersbusiness.com. And thank you so much for being our guest today, Jesse. It's great to have you on. In part
Very
one
welcome.
of the Peptide series, we built the foundation what peptides are, how they differ from steroids or traditional supplements, where the narrative has broken down, and why quality and physician oversight are not optional, right? You got to have that.
Yep.
Today,
Yeah.
we moved into the real world. We looked at why, what is actually driving consumer demand, why providers and med spas are paying serious attention now, and why the right structure for your fitness or wellness business matters as much as the product itself. Here is the we haven't resolved all the tension, right? And covered all the questions today. And we've done that on purpose. We talked about what credible participation looks like with peptides, but we did not answer the harder question. How do you know whether a program that you're looking at is credible or not? How do you evaluate sourcing at the level that's much deeper than cost? How do you know if a physician oversight is real or if it's just performative? And then we want to get into biomarkers and how to really know if monitoring is actually working or if it's meaningful when you are testing for it. So those are some of the questions we'll go deeper into and answer in part 3. And if you are a provider or a wellness business evaluating whether to enter into this space for long-term, part 3 is one you cannot skip. If today's conversation helped you understand where peptide demand is actually heading, and what the role is in your wellness journey, then please subscribe to the Well Wave Club YouTube channel, and also share this episode with someone who needs to get a clearer picture. And always remember, everyone, wellness, it's in you.